Hello, my name is Muhayman Sadiq, and today I'm doing a blog for the Academy of Online Radiology Education. For some background, I'm an incoming diagnostic radiology resident at UT Health Houston, also doing my prelim at UT Health Houston, and just finished a postdoc in musculoskeletal and emergency radiology at the program. Today's blog is going to be titled AI and Arthritis Imaging, the Path to Automation, and I'm pleased to have Dr. Gozi and Dr. El-Sayas helping me as my editors on this project. So this blog is going to be based around an article titled Evaluating Potential for AI Automation of Quantitative and Semi-Quantitative MRI Scoring in Arthritis, especially at the knee, which was a systematic literature review performed by Dr. McDonald and colleagues that was published in Skeletal Radiology in March of 2025. For some background, MRI plays a critical role in evaluating joint health and tracking disease progression in arthritis, especially osteoarthritis. Traditional scoring systems such as WORMS, MOAKS, and blocks help quantify joint abnormalities, but require time-intensive interpretation by experts, often introducing variability even amongst experts within the field. With nearly 600 million people affected by osteoarthritis globally, there is growing interest in using artificial intelligence to automate these MRI assessments, aiming to enhance efficiency, objectivity, and scalability. This systematic literature review investigated the feasibility of automating quantitative and semi-quantitative MRI scoring systems in arthritis. A total of 129 randomized controlled trials published between 2014 and 2024 were reviewed, with a strong focus on knee osteoarthritis. Researchers evaluated which biomarkers on MRI, such as cartilage loss, effusions, synovitis, bone marrow edema, erosions, osteophytes, and meniscal or labral injuries, are most amenable to automation. The analysis was guided by expert radiologists and AI specialists who assessed technical complexity, reproducibility, and suitability for machine learning modules. There has been previous literature on the use of AI and automation for different types of arthritis. One of those was a 2025 study published in RMD Open, which produced a convolutional neural network for automated scoring of hand rheumatoid arthritis on MRI and also psoriatic arthritis of the hand on MRI. The researchers trained and validated their AI system using validated rheumatoid arthritis scoring systems and psoriatic arthritis scoring systems as well, and their models achieved impressive diagnostic accuracy with an area under the curve of 92% and over 91% accuracy for osteitis and also over 80% for synovitis. And the system demonstrated strong correlation with human annotation, with impressive results all around for erosions, osteitis, and slightly less for synovitis. And this convolutional neural network-based approach achieved these results using fewer MRI sequences than conventional scoring methods, highlighting the potential for more efficient clinical implementation of AI when being used as an adjunct to a board-certified radiologist. Another pertinent study was published in 2024, which discussed the use of AI models and how they're applicable to ultrasound imaging in hand osteoarthritis. And this project specifically developed an AI model for both segmentation of joint ultrasound images and severity scoring of osteophytes following the EULAR-OMERACT grading system. And the system demonstrated very strong agreement with physician assessments all around across different joints, with a very, very impressive set of results for percentage close agreement for the metacarpophalangeal, proximal interphalangeal, distal interphalangeal, and carpometacarpal joints specifically. And overall, the results were highly impressive, demonstrating AI's potential beyond MRI analysis. In addition, there was a study published in 2022 which provided additional context on the reliability and validity of computer-aided quantification in inflammatory arthritis, and this found excellent intra and inter-readability for bone erosion volume, synovial membrane volume, DCE MRI perfusion parameters, and the meta-regression analysis showed that computer-aided and manual methods provide comparable reliability for quantifying bone erosion, synovitis, and perfusion parameters. So going back to the initial study, the results were very, very impressive. WORMS and MOAKS were the most commonly used scoring systems for knee osteoarthritis, and several in-house and emerging AI integrated systems were also identified. High T2 contrast on MRI made these biomarkers for effusion and synovitis readily automatable. Although cartilage loss is a key osteoarthritis biomarker, it remains difficult to automate due to the anatomical complexity and variable MRI quality when trying to assess cartilage of the knee. Potential for automation does exist for bone marrow edema. The challenges remain in accurate lesion localization and segmentation. Erosions and osteophytes can of course be detected by AI with high-resolution imaging and can be trained on standardized definitions when using these different AI models. And AI has also shown really good performance in detecting meniscal abnormalities, and integration with cartilage and bone marrow edema data may help to improve clinical insights from this end. And fat metaplasia and fat pad changes are readily visualized on T1 weighted MRI, and they're both considered feasible targets for AI-based analysis. On the whole, this review highlighted strong potential for AI to automate interpretation of MRI-based scoring in osteoarthritis, especially for effusion and synovitis as well as meniscal tears. However, accurate cartilage and bone marrow edema quantification still remains a challenge. Existing scoring systems can serve as a foundation for training AI models, and these future tools are likely to enhance the clinical workflow, improve standardization of different quantification methods, and improve longitudinal disease tracking when managing osteoarthritis as well. On the whole, this review outlines the feasibility of automating complex semi-quantitative osteoarthritis scores with refined imaging and training datasets. AI holds very strong promise in supporting clinical trials and patient care when looking to move arthritis management forward in the future. AI can automate select MRI biomarkers in arthritis, including effusion and meniscal tears. Existing scoring systems provide a valuable framework for AI development and standardization across models. Although cartilage loss and bone marrow edema require further refinement for reliable automation, being able to automate different aspects of MRI quantification prior to that can help in this process of making these more reliable. In addition, high-resolution MRI sequences enhance AI performance in osteophyte and erosion detection, and AI can improve diagnostic consistency, enable large-scale analysis, and support personalized arthritis care. Thank you so much for listening.